Choosing between Medicare Advantage and Medicare Supplement can feel overwhelming. Over 65 million Americans are on Medicare, and many face this decision. Today, we'll show you how to choose the right option. Medicare Advantage and Medicare Supplement are different ways to get coverage. Understanding this can save you thousands annually. Medicare Advantage, or Part C, replaces original Medicare with a private all-in-one plan. It includes Part A, Part B, usually Part D, and often dental, vision, and hearing. Medicare Supplement, or Medigap, works with original Medicare to fill gaps. You keep original Medicare, add Medigap for copays and deductibles, and need a separate Part D plan. The key difference: Advantage switches you to private insurance, while Supplement adds protection to original Medicare. This impacts costs, doctor choice, and benefits. Let's compare your options side by side. Medicare Advantage plans often have low or $0 monthly premiums, but you pay copays for services. A doctor visit might cost $15 to $50, and a hospital stay $200 to $400 per day. Medicare Supplement plans have higher monthly premiums, typically $100 to $300. However, you pay little to nothing when you receive care, as most policies cover nearly all out-of-pocket costs. Take Robert, a healthy 66-year-old. With Medicare Advantage at $0 monthly, he spends about $800 yearly in copays. Linda, 68, manages diabetes. With Medicare Advantage, her copays total $4,000 annually. With Medicare Supplement at $200 monthly, she pays $2,400 in premiums, but nearly zero out-of-pocket at appointments. Your total cost depends entirely on your healthcare needs. Now, let's discuss choosing your doctors. Medicare Advantage plans use networks like HMOs or PPOs. HMOs require in-network care, while PPOs allow out-of-network at a higher cost. Network restrictions can be problematic if you travel, need a specialist for a rare condition, or if your doctor leaves the network. Medicare Supplement eliminates this. You can see any doctor who accepts Medicare anywhere with no referrals needed. Medicare Advantage often includes extras like dental, vision, hearing, gym memberships, and wellness programs. Prescription drug coverage is usually built in at no extra charge. Medicare Supplement only covers what original Medicare covers, nothing more. You'll need separate dental and vision insurance, plus a standalone Part D plan for medications. Medicare Advantage has an annual out-of-pocket maximum. In 2026, this maximum is $9,250. Once you hit this limit, the plan covers 100% of covered services. If you have a PPO plan and use out-of-network doctors, combined costs can reach $13,900. Medicare Supplement has no out-of-pocket maximum, but your costs are predictable since the plan covers most expenses from the start. Starting in 2026, all Part D plans cap prescription drug costs at $2,100 per year. Your plan tracks this automatically. Once you reach this amount, you pay nothing for medications the rest of the year. Now let's figure out which path matches your situation. Medicare Advantage is ideal if you're healthy, stay local, want low monthly costs, and value extras like dental and vision. You'll pay copays when you use services, but your upfront costs are minimal. Medicare Supplement works better if you have chronic conditions, travel frequently, see specialists, or want complete freedom to choose any doctor nationwide. You'll pay higher monthly premiums but have predictable, minimal costs at the point of care. The most popular Medigap options are Plan G and Plan N. Plan G has higher premiums but covers nearly everything, including excess charges, when doctors bill above Medicare's approved amount. Plan N costs less monthly but requires $20 office visit copays and $50 ER copays and doesn't cover excess charges. One important thing to understand about Medigap: how your premium changes over time depends on the rating method. Attained age plans start cheap but increase automatically as you age. Issue age plans cost more initially but only increase with inflation, not age. If you can afford it, issue age gives you more stable costs long term. Before you decide, let's talk about the mistakes that cost people thousands. The biggest error is choosing based only on monthly premium cost. Calculate your total annual spending, including all copays and potential medical needs. Another mistake is ignoring network restrictions. Verify your current doctors are in-network before switching. People also overlook checking if their medications are covered by the formulary at reasonable costs. Here's the biggest risk many people overlook. Let me tell you about James, who chose Medicare Advantage at 65 because he was healthy. At 71, he was diagnosed with cancer and wanted to switch to Medigap for better access. Insurance companies reviewed his medical history and denied him coverage entirely. He was trapped in Medicare Advantage, forced to navigate networks during cancer treatment. This happens because switching from Advantage to Supplement requires medical underwriting after your first year. Companies can review your health and deny coverage or charge much higher rates. Rules vary by state. Some offer guaranteed issue windows, so check your state's Medigap rights before you switch. The safest time to secure Medigap is during your initial enrollment period at 65. During this 6-month window, companies cannot deny you or charge more for health issues. This guaranteed protection locks in your coverage regardless of future health problems. Medicare's annual enrollment runs October 15th through December 7th. That's when you can make changes for the following year. If you're already in a Medicare Advantage plan, there's another window from January 1st to March 31st to switch MA plans or return to original Medicare. You also have a critical 12-month trial right if you choose Medicare Advantage when first eligible. During this window, you can switch to Medigap without health questions. After this period, switching requires medical underwriting, which can result in denial or higher costs. There's no single right answer for everyone. The best choice depends entirely on your health, budget, and personal preferences. Consider how often you see doctors, what medications you take, whether you travel, and if your doctors accept Medicare Advantage networks. Open enrollment is happening right now through December 7th. This is your window to make changes that take effect January 1st. Don't wait until the last minute when offices are overwhelmed. Download our comprehensive comparison guide with cost worksheets to evaluate both options. Make a list of your doctors and medications. Verify network coverage for Medicare Advantage plans, and get quotes for Medigap Plan G and Plan N in your area. For free personalized help, contact your state health insurance assistance program. Open enrollment ends December 7th. Take action this week to make a thoughtful choice your future self will thank you for.
Thank you for watching GovClarity. Remember, you can find our complete guide and all official links in the More section. If you found this helpful, please like, subscribe, and share it with others who might benefit. Remember to hit the notification bell so you never miss our latest videos. We're here to make government procedures easier for you every step of the way.